we're going through this workshop. And private sector, it's not just private health sector, it's the entire economy. And it's my pleasure to welcome to the event today Mr. Abubakar Suleiman, the MD CEO of Sterling Bank. And I'd like to invite him to the stage. Thank you for putting this together in collaboration with the Healthcare Federation of Nigeria. Sterling Bank has for many years been one of the leading supporters of Healthcare Federation of Nigeria, and we continue to benefit from this partnership. He has appropriated my sanitizer, and I will dollarize that for him at the end of the day. You're most welcome. So please have your seat. We'll move quickly so that we can hear what the National is doing. Lagos has alluded to the collaborative effort with the private sector. At the beginning, Lagos had the testing responsibility and handled it solely at the public level. Standards need to be established. The challenges and hiccups along the way need to be understood before a systematic incorporation of the private sector was done. And as you can see the evolution now, private sector is now doing the majority of the laboratory testing in Lagos. A round of applause to the Honorable Commissioner for his leadership. So let me invite the coordinator of the Presidential Steering Committee to give us a glimpse of what the national COVID-19 strategy looks like, and to also probably preface that with a little bit of an update on where we are. We know we've received 3.9 million doses of AstraZeneca. We were hoping to have received in May, according to the report, Johnson & Johnson. So where are we? Can our hopes rise? And how can the private sector support the government in making this work? Please put your hands together as Dr. Mohammed approaches the lectern to present his paper.
Thank you very much for the generous introduction. Honorable Commissioner for Health, Lagos State, the MD, Sterling Bank, the representative of the Honorable Minister of Health, and also the Director of Healthcare Federation, Dr. Ajayi, and also Mrs. Claire. I got a snap this thing of your presentation. It was really good. Thank you for inviting me to this event. And ladies and gentlemen, it's really my pleasure to come to Lagos once again, particularly in this engagement, to discuss on where we are with the vaccination process and the engagement and the role the private sector plays. First, I must say that the Honorable Commissioner has made a very elaborate and a distinguished presentation, giving an overview of what is happening nationally and specifically focusing on what is happening in Lagos State. I must say that Lagos has stood up to its name as the center of excellence for the country. For us in the national response in terms of COVID, Lagos has just demonstrated that. To which I will add also that Lagos is now the pace setter in terms of the COVID response, in terms of the engagement of the laboratories, and also in terms of the drive towards getting the private sector to participate in vaccination. Lagos has always been the center of unity, just as exemplified by the presentation. Whatever happens in Lagos, it affects the entire country. There is no state that is not fully represented in Lagos State. And it has also taken the title of the gateway of the country, because over 75% of all passengers arriving in Nigeria by air come through Lagos. So perhaps we may need to revisit these titles for the states, because Lagos actually takes in a lot, center of commerce also. We will give that to Lagos. But thank you very much. Above all, I mean, what I want to say is that Lagos is doing a lot, and we really appreciate the effort that the state government is making. And this is not without having a good leadership and an enabling environment to be able to achieve this. For us at the national level, I will start by saying that very early on in the pandemic, back in March 2020, when we had the first case and we knew that there was really, COVID-19 was really going to be changing the dynamics of not only the health sector, but of the economy, the budget, and the entire operations, not only in Nigeria, but also globally. Mr. President took the unprecedented step to set up a multi-sectoral and a multinational response that had all of government approach. The country was nearly brought to a close because you have about 15 ministers serving in the committee. And you also had very critical MDAs that were also supporting. So the private sector was very key, very early on in the response. And for the initial 3 to 6 months of the national response, most of the funding that was used to contain the epidemic and also to mitigate, the impact of the epidemic